November 14, 2024. A veteran sits at a kitchen table with a stack of VA letters, bank statements, and medical records. On one page is a benefit he never knew he could claim. For thousands of veterans, that missing claim can mean extra monthly compensation, sometimes worth hundreds or even thousands of dollars. The reason is simple. Many veterans know about standard VA disability compensation. Fewer know that the VA can pay additional compensation when certain conditions create severe limitations, require regular assistance, affect specific body parts, or leave a veteran substantially confined to the home. These benefits are often discussed under the rules for special monthly compensation, along with related forms of additional support. The exact amount depends on the veteran's circumstances, service-connected conditions, and the level of loss or impairment recognized by the VA. For some veterans, the problem is not eligibility. The problem is that nobody clearly tells them to look. A disability rating can feel like the end of a long process. A veteran files the claim. Medical evidence is collected. The VA reviews the records. A decision arrives with a percentage. Then, life continues. What many veterans do not realize is that the percentage alone does not always tell the whole story. Two veterans can have the same combined disability rating and face very different daily limitations. One may be able to move independently, prepare meals, manage medication, and leave home without assistance. Another may need help getting dressed, bathing safely, taking medication, or protecting themselves from hazards during the day. A standard rating may not fully describe the second veteran's situation. That is where additional VA compensation rules can become important. Special monthly compensation, commonly called SMC, is an extra payment available in qualifying cases involving certain severe disabilities or combinations of disabilities. It is not simply a bonus for reaching a high percentage. Eligibility depends on specific legal and medical criteria. The rules cover several different situations. Some involve the loss of use of a hand or foot. Some involve blindness or severe visual impairment. Others involve certain combinations of service-connected disabilities. Some cases involve a veteran who needs regular aid and attendance from another person because of service-connected limitations. The details matter because the VA does not use one single test for every SMC claim. A veteran may hear the words special monthly compensation and assume the benefit is only for someone with a 100% disability rating. That assumption can stop a claim before it starts. Some SMC categories are connected to specific anatomical losses or losses of use. Others can arise from combinations of disabilities that meet particular requirements. Another common assumption is that a veteran must be completely dependent on another person. That is not necessarily the way every aid and attendance determination works. The VA looks at the actual effects of disability. Can the veteran dress and undress without assistance? Can the veteran keep themselves ordinarily clean and presentable? Can the veteran feed themselves without help caused by loss of coordination or extreme weakness? Can the veteran manage the needs of nature? Can the veteran protect themselves from everyday hazards because of physical or mental limitations? These questions are not about whether a veteran occasionally needs help on a difficult day. They are part of a broader evaluation of whether regular assistance is required because of qualifying service-connected disability. What nobody knew was that the most important evidence may already exist. A veteran might have years of medical records describing falls, mobility problems, weakness, impaired balance, chronic pain, loss of function, or the need for assistance with activities of daily living. A spouse may have been helping for years. An adult child may visit regularly to manage medication or transportation. A home health provider may already document the veteran's daily limitations. But medical treatment and a VA compensation claim are not the same process. A doctor can document a serious limitation without making a legal determination about VA benefits. A VA claim reviewer may not automatically treat every medical record as a request for every possible form of additional compensation. The connection between the evidence and the benefit still has to be established under VA rules. Because of this, a veteran can receive treatment for severe problems while never filing for the additional compensation those problems might support. The first step is understanding what kind of benefit may apply. For special monthly compensation, the VA uses different levels identified by letters and combinations of letters. The payment structure can become complicated. Some levels apply to particular losses. Others apply when multiple severe disabilities are present. Higher levels can involve additional combinations and more extensive requirements. This is why veterans should be careful with simple statements claiming that every veteran at a certain disability percentage automatically qualifies for an extra check. There is no universal shortcut. A 100% rating does not automatically establish entitlement to every type of SMC. At the same time, a veteran should not assume that a rating below 100% makes every additional benefit impossible. The specific service-connected disabilities and the exact criteria control the outcome. One of the better-known forms of additional compensation involves aid and attendance. The phrase sounds straightforward. The actual standard is more detailed. The question is whether the veteran requires regular aid and attendance because of qualifying service-connected disability. The need does not necessarily mean that assistance must be required every minute of every day. The VA considers the veteran's overall condition and the specific limitations established by the evidence. A veteran who can technically perform a task but faces serious danger while doing it may have a very different case from a veteran who performs the task safely and independently. Falls can matter. Severe weakness can matter. Loss of coordination can matter. Mental limitations affecting safety can matter. The need for regular help with bathing, dressing, medication, mobility, or protection from hazards can matter. But the evidence must show why the assistance is needed and how the service-connected condition contributes to that need. That last part can become critical. A veteran may have several medical conditions, some service-connected and some not. The VA has to evaluate the legal basis for the benefit under the applicable rules. If a veteran needs assistance because of a combination of conditions, the relationship between the service-connected disabilities and the daily limitations may need to be clearly explained. A vague statement saying the veteran needs help may not answer the important questions. What help is required? How often is it required? Why is it required? What medical limitations create the need? Which service-connected conditions are involved? Detailed evidence can make those questions easier to evaluate. Then there is another area that causes confusion: the housebound benefit. The word housebound can lead veterans to picture someone who never leaves the home under any circumstances. VA rules can be more specific than that general image. One route to housebound special monthly compensation involves a particular rating structure combined with additional separate disabilities. Another route can involve being substantially confined to a dwelling and the immediate premises because of service-connected disabilities, with the confinement reasonably expected to continue. Again, the exact legal requirements matter. A veteran who rarely leaves home because of severe service-connected limitations may wonder whether the housebound criteria apply. The answer depends on the rating history, medical evidence, and the specific regulatory standard. A veteran who leaves home for medical appointments does not necessarily settle every question by that fact alone. The overall legal test and the reason for the confinement still matter. This is another reason broad social media claims can be misleading. An extra VA payment is not triggered simply because someone is elderly. It is not triggered simply because someone has a disability rating. It is not triggered simply because someone stays home most days. The benefit depends on the criteria. But thousands of veterans can still miss opportunities because they never compare their daily limitations with those criteria. The missing step is often the review. A veteran can start with the current VA decision letters. Look at every service-connected condition. Look at the individual ratings. Look at the effective dates. Look for any existing references to special monthly compensation. Then compare the rating history with the veteran's present condition. Has mobility become worse? Has vision changed? Has the veteran lost the effective use of a limb? Does the veteran now require regular help with activities of daily living? Has another disability become service-connected since the last major review? Are there separate disabilities that may meet specific requirements together? The veteran should not guess the legal answer from the combined percentage alone. The combined rating system itself can be confusing because VA percentages do not add in the ordinary way. A combined rating is calculated under VA rules. Two veterans with the same final percentage can have very different individual ratings behind that number. That structure can matter when reviewing potential entitlement to additional compensation. Medical evidence should also be organized around function. A long diagnosis list may show what conditions exist. It may not clearly show what the veteran can and cannot do. Functional evidence answers different questions. How far can the veteran walk? Can the veteran stand safely? Can the veteran get in and out of bed without help? Can the veteran bathe without falling? Can the veteran dress independently? Can the veteran prepare food safely? Can the veteran remember medication? Can the veteran respond safely to a fire, fall, or other ordinary hazard? Can the veteran travel outside the home without assistance? These details can appear in clinical records, occupational therapy notes, physical therapy records, caregiver statements, and other supporting evidence. The strongest evidence depends on the individual claim. Within the VA system, there are also forms and examination processes designed to document the need for aid and attendance or housebound status. A medical professional may provide information about the veteran's functional limitations, diagnoses, and need for assistance. The exact form and evidence requirements can change, so veterans should check current VA instructions before filing. The claim itself should identify the benefit being sought when possible. A veteran should not rely on a casual statement buried inside another application. The record should clearly present the request and the evidence supporting it. This does not mean a veteran must become an expert in every SMC level before taking action. VA accredited representatives, veterans service organizations, accredited claims agents, and accredited attorneys may help veterans understand the process. Representation rules differ, and veterans should verify accreditation before relying on anyone for VA claims assistance. Free help may be available through recognized veteran service organizations and other accredited representatives. The important point is not to pay someone merely because they promise a secret benefit. There is no secret code. There is no automatic extra check that every veteran has failed to claim. There are specific benefits under specific rules. Scammers understand that confusion. A message may claim that every veteran can unlock a hidden monthly payment by submitting a simple form. Another may demand a fee for access to a benefit that is already publicly available. Some may imply that a certain age automatically qualifies a veteran for new compensation. Those claims should be treated carefully. VA benefits depend on law, evidence, and the facts of the individual case. A veteran should review information through official VA sources and qualified accredited assistance before signing an agreement or paying a fee. There is another issue that veterans often overlook: the effective date. In VA compensation, the date of the claim and the date entitlement arose can affect when payments begin. The rules are not identical for every situation. A delay in filing can matter. That means a veteran who has needed regular assistance for years may still need to establish when the legal requirements for the benefit were met and when a qualifying claim was filed or otherwise recognized under VA rules. This is not a reason to rush blindly. It is a reason not to postpone a review forever. A veteran who believes their condition has changed should document the change. Keep medical appointments. Report functional problems accurately. Save relevant records. Ask medical professionals to describe limitations clearly when appropriate. Explain how the condition affects ordinary daily activities. Then compare that evidence with the current benefit criteria. The same approach can matter after a new disability decision. Suppose a veteran receives service connection for another serious condition. The new rating may change the overall disability picture. A benefit that did not apply before may need to be reconsidered. Suppose a veteran develops additional loss of function years after the original rating decision. The old decision may not reflect the current level of impairment. Suppose a spouse or caregiver gradually begins providing regular assistance. The change may happen so slowly that nobody recognizes it as a major development. One day, the veteran still handles everything independently. Months later, someone else is helping with bathing, dressing, medication, transportation, and safety. The change feels gradual. The evidence may show a different picture. That is why a yearly benefits review can be useful. Review the service-connected disabilities. Review the rating decisions. Review current medical limitations. Review daily assistance. Review whether the veteran's living situation has changed. Review whether a caregiver now performs tasks the veteran previously handled alone. The purpose is not to manufacture a claim. The purpose is to make sure the record matches reality. Some veterans avoid filing because they fear that opening a new claim will automatically reduce an existing rating. A claim can involve review, and outcomes depend on the facts and procedures involved. Veterans should understand the scope of any claim and seek qualified guidance when concerned about a potential effect on existing benefits. Fear alone should not replace informed advice. Others avoid filing because the paperwork looks too complicated. That is understandable. SMC rules can be technical. Rating decisions can use abbreviations and legal language. Medical evidence can span decades. But a complicated benefit is not the same thing as an unavailable benefit. The process begins with a basic question. What does the veteran actually need help with today? Not 10 years ago. Not when the original claim was filed. Today. If the answer includes regular assistance with basic personal functions, serious safety limitations, loss of use, severe sensory impairment, or substantial confinement related to service-connected disabilities, the veteran may have a reason to investigate further. The next question is whether the evidence explains those limitations clearly. Then comes the legal review. Does the situation meet the requirements for a particular SMC category or another form of additional VA compensation? Only the facts and applicable rules can answer that. There is also a practical difference between hearing about a benefit and formally claiming it. A veteran may have heard another veteran mention aid and attendance at a local meeting. A family member may have seen a video about an extra VA check. A caregiver may have searched online and found several conflicting explanations. That information can start the conversation. It should not end it. The VA claim record, current regulations, official guidance, and qualified accredited assistance are more important than a viral headline. The phrase "never claim" can sound dramatic. In reality, the problem is often more ordinary. A veteran does not know the benefit exists. A doctor treats the condition but does not discuss compensation. A family member does not know what to search for. A previous rating decision is read once and placed in a drawer. A gradual decline becomes normal. Years pass. Then someone finally notices that the veteran is receiving a standard disability payment while depending on another person for tasks that once required no help. At that point, the review begins. The records are gathered. The current conditions are listed. The service-connected disabilities are identified. The daily limitations are described. The applicable benefit rules are checked. A claim or request for review is prepared when the criteria may be met. The outcome is not guaranteed. Some claims will be denied because the evidence does not meet the legal standard. Some will require additional evidence. Some will be approved at a level different from what the veteran expected. Some veterans will discover they were already receiving a form of special monthly compensation without recognizing the abbreviation in their award letter. But none of those outcomes can be known by ignoring the question. For a veteran whose daily life has changed, the most valuable step may be to stop looking only at the combined rating. Look at function. Look at assistance. Look at safety. Look at the individual service-connected conditions. Look at what has changed since the last decision. Then compare the full picture with the benefits that actually exist. An extra VA check is not hidden in the sense of being secret. The rules are public. The forms are available. The criteria are defined. But a benefit can remain invisible when nobody knows which rule to read. For thousands of veterans, that may be the difference between a disability rating on paper and a full review of the help their condition now requires. They had the records, they never asked about SMC.